The word chronic means long-term and unrelenting, not something that goes away quickly. Add to this the descriptor pain, and you have chronic pain, which happens to too many people in too many guises. There are many examples: chronic headaches, chronic low back pain, the post-herpetic pain following shingles, the neuropathic foot pain of diabetes, and the body-wide muscle pain of fibromyalgia, to name a few. The bad news is that once a person has one of these chronic pain syndromes, it's very difficult to be rid of it, like an unwanted guest who never wants to leave. Surgery or medicines, especially opioids, too often are of no help and sometimes makes things worse. Even injections of steroids, which are invasive, expensive, and often overused, are useless for chronic pain. In the end, too many people still suffer. The pain takes control and the person shuts down completely, becomes inactive, which only turns attention toward the pain. Most helpful is to understand that immobility worsens the situation. If a joint or a muscle is not used regularly, it barks and bites when called upon to be moved, which in turn results in less movement, more pain, and even less movement. This cascade, if unstopped, can result in severe disability and more time to dwell on the pain, often a sense of hopelessness, the addiction potential of pain medicines. This becomes a vicious cycle and is exactly the reason they say, use it or lose it. Paradoxically, very often the most effective way to bring people out of a spiraling progressive and chronic pain is to get them moving. Again, the best answer for chronic pain is usually not surgery or more pain medicines. Of course, each case is different, and sometimes a trapped nerve needs release or severe inflammation needs to be rested. However, often careful moving through stiffness and discomfort gives the most long-term relief. As they say, sometimes you have to pain to gain. One patient told me, my best help was to accept the fact that I had to live with some pain, get on with life, and begin exercising. And the antidepressants didn't hurt either. Studies show that return to function, although not easy, is the key to rehabilitation. Chronic pain doesn't have to mean progressive immobility, disability, and hopelessness. We should remember to accept the pain when we have to, and when advised by the doctor, to move those muscles. You gotta use it or lose it.